Okay. So we can start.
So good morning, good afternoon, and good evening to everyone who's joined this webinar. My name is Chris Micton, and I work in the Demographic Change and Healthy Aging Unit at WHO, where I lead the work on the abuse of older people, and I'll be the chair today. I'd like to warmly welcome you all to this webinar to mark World Elder Abuse Awareness Day. And the topic of the webinar is progress and priorities for ending abuse of older people during the decade of healthy aging. Before we start, I'll just hand over to my colleague Kazuki Yamada, who will give you some explanations about how the interpretation system will be working today. Kazuki.
Hello, good morning, good afternoon, good evening, everyone. Just a note that we are providing live interpretation during this event via an application called Microsoft Translator. You should have received a few emails from us already, but if you haven't done so already, I will be posting the instructions to use this application in English, French, and Spanish in the chat box. So please do refer to that to access interpretation in whatever language you speak during the duration of this webinar. I also wanted to encourage everyone to use the Q&A function rather than the chat function to ask questions, where we'll be monitoring and answering questions, and also to let you know that this webinar is being recorded. Thanks, Chris.
Thank you, Kazuki. So now we'll turn to the first of two opening addresses by Dr. Etienne Krug, who's the director of the Department of Social Determinants of Health at the World Health Organization. So over to you, Etienne.
Thanks so much, Chris and Kazuki. Good day, colleagues. A pleasure to be here with all of you to mark World Elder Abuse Awareness Day 2024. A day that was created to focus the world's attention on a really neglected public health and human rights and development problem, namely elder abuse, and to catalyze action to address it more. As we start this webinar, I cannot not mention Elizabeth Podnieks, who sadly passed away earlier this year. She was instrumental in getting this day adopted and has been instrumental in moving the whole elder abuse field forward internationally as well as in Canada. I got to know Elizabeth when I was the editor of the World Report on Violence and Health, which came out in 2002, so it's quite a while ago, and she was very helpful in shaping the chapter at the time on elder abuse. So I certainly want to remember her here and thank her for everything she has done to move this field forward and to get this day adopted. These days are important in order to get the word out, keep the issue in the attention, and above all, catalyze action. Let me thank also DESA, OHCHR, and the International Network on the Prevention of Elder Abuse, with whom we are hosting this event together, which has the aim to update you on several of the priorities that were identified in 2022 for tackling abuse of older people within the decade of healthy aging. These priorities are actually very similar to the ones identified for the World Report on Violence and Health in 2002, showing that things take time. This is an important issue. We have made quite some progress since the World Report came out in 2002, particularly on identifying what works, and I want to thank all of you who have helped us do that. But things are too slow, so we really need to collaborate to make sure we move faster on this topic in the years ahead. It's an issue that gets not enough attention, not enough resources. At the same time, I'm impressed that we have so much collaboration now with so many of you. So thanks to our sister agencies, to the International Network for the Prevention of Elder Abuse, INPEA, University of Malaya, the partners, many of you with whom we're working on the intervention accelerator that you're going to hear about more today. And of course, a big thanks also to all the speakers who are joining us today. I look very much forward to the discussion and to mark this important day. Thanks to all.
Thank you. Thank you very much, Etienne. So now we'll turn to the second opening statement, which is in the form of a video recording by Masumi Ono, who's a chief of the Social Inclusion and Participation branch of UN's Department of Social and Economic Affairs. Kazuki, thanks.
Distinguished guests, colleagues, on behalf of the Department of Economic and Social Affairs, I am honored to join you to commemorate the 2024 World Elder Abuse Awareness Day. On this day, let us join forces to raise awareness and bring attention to the abuse perpetrated against older persons, a problem that, despite its high prevalence, remains largely overlooked in our societies. Elder abuse is defined as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust and causes harm or distress to an older person. It includes physical, sexual, psychological, and emotional abuse, financial and material abuse, abandonment, neglect, and serious loss of dignity and respect. Available data show that around 1 in 6 people 60 years and older experienced some form of abuse in community settings. Rates of abuse were even higher in institutions such as nursing homes and long-term care facilities. Despite these gruesome numbers, data, research, and public awareness of elder abuse is lacking. We need to do much more. We need to develop and strengthen policy and legal frameworks at the national and international level in order to confront elder abuse. The Madrid International Plan of Action on Aging identified many actions that need to be undertaken to eliminate all forms of neglect, abuse, and violence against older persons. For example, the plan identified the need to sensitize professionals and educate the general public, to enact legislation and to establish services for victims of abuse and rehabilitation arrangements for abusers, and to encourage cooperation between government and civil society. It is also key to enable victims of elder abuse to access legal resources and support, and to ensure that perpetrators are held accountable. Responsive policy and legal frameworks demand more and better data on the prevalence, risk, and protection factors of elder abuse. Data and research on elder abuse must take into account how other grounds of discrimination, such as gender and disability, intersect with abuse against older persons. To ensure that older adults live with dignity and be free from abuse and neglect, older persons themselves and their representatives must be at the center of policy and decision-making processes. Tackling elder abuse calls for a paradigm shift in communities. We need to promote intergenerational solidarity and build a culture of respect and care for all individuals, including older persons. MIPA emphasizes that fostering solidarity between generations within families, communities, and nations is fundamental for the achievement of a society for all ages. This requires combating ageism and ensuring that older persons enjoy their human rights on an equal basis with others. As we commemorate World Elder Abuse Day, remember that each and every one of us, the young and the old, plays a role in promoting solidarity between generations, combating discrimination against older people, and building a society for all ages. We are encouraged by the interest and engagement of all participants in this event. Your contributions will help raise the profile of elder abuse as we create a future where everyone, regardless of their age, can live with dignity. Thank you.
Thank you. Thank you very much, Ms. Ono, for that opening address. Now I'm going to go over these 5 priorities. So could we have the slides, please?
So next one, please. So in 2002,
we published Tackling the Abuse of Older People, 5 priorities for the United Nations Decade of Healthy Aging. And this was based on a wide-ranging consultation, and we also did a number of evidence synthesis projects to inform this priority setting exercise. And the 5 priorities we came up with are, next slide.
Here. And I'll go through them
One by one, and I'll also indicate who among our distinguished speakers will be addressing each of these priorities. Next slide, please.
So the first priority
Is to combat ageism. I think it's widely viewed that ageism is a major reason the abuse of older people receives too little attention. It's also generally considered to be a major risk factor for the abuse of older people. And we have Ms. Helena Herklotz, who will be addressing this priority today. Next slide, please.
I don't see it moving.
Oh, yes, thanks. So priority 2 is to generate more and better data on prevalence and on risk and protective factors. There is currently too little data on these 2 aspects of the problem, especially from low and middle income countries. Data on prevalence is absolutely key if you want to communicate the scale of the problem to raise awareness, and data on risk and protective factors are critical for developing effective interventions. We have 2 speakers today who are going to speak on this priority. The first one is Dr. Fadzila Mon-Midin from the University of Malaya, and the second one is Dr. Lynn-Marie Sardina from WHO. Next slide, please. The third priority is to develop and scale up cost-effective solutions. When we published our document, Tackling Elder Abuse, 5 Priorities, there were almost no effective solutions that were supported by evidence from high-quality evaluations. Things have changed a little bit, as you'll hear. And there's still we're lacking cost-effective and scalable solutions. We have 2 speakers addressing this priority. The first is Dr. Laura Campotena, who's a WHO consultant, and the second speaker is Dr. George Ruamba from the University Joseph Kizerbo in Burkina Faso. Next slide, please. Priority number 4 is to make an investment case for the issue. In addition to making the moral, the human rights, and the public health case, it's absolutely critical that we also make an investment case to increase the global priority of the issue. Fortunately, we have almost no data on costs of interventions and the cost effectiveness of these interventions, which are really prerequisites for making this investment case. So unfortunately, we do not have a speaker today to address this priority. Next slide. And the 5th and last priority is to raise funds. There is agreement that the field is underfunded and that more funds are required to improve the understanding of the topic, to develop, test, and scale up cost-effective solutions, and to increase awareness of the issue. And to address this priority, today we have Dr. Terry Fulmer as a speaker, who is from the John A. Hartford Foundation in the United States. Next slide, please. And after we hear our speakers addressing the 5 priorities, we'll have 2 discussants who will comment on these presentations. The first is Dr. Claudia Mahler, who's a UN independent expert on the enjoyment of all human rights by older persons. And the second discussant is Dr. Abla Sebai from the American University of Beirut in Lebanon, and she also is a regional representative of the International Network for the Prevention of Elder Abuse. So that's the 5 priorities and an overview of the program for today. So now we'll turn to our first speaker, Ms. Helena Herklotz. with her presentation. Over to you, Helena. Thank you.
Thank you very much. And hello, everyone. It's very good to be part of this very important webinar today. My name's Helena Herklots. I'm the Independent Older People's Commissioner for Wales, and my role is to protect and promote the rights of all older people. As part of this, one of my priorities is to work to stop the abuse of older people. And as part of this, I've been looking at the links between ageism and abuse. Next slide, please. As we know, ageism is the stereotyping, prejudice, or discrimination against people based on their age or their perceived age. We know it's extremely damaging and can have significant impacts on the physical and emotional well-being of older people. We know that ageism can also be internalized by older people, resulting in them limiting their own behavior and opportunities. For example, perhaps not seeking help when they're at risk of abuse because they feel that the support isn't meant for them or they're not worthy of that support. Next slide, please. We know that ageism is a major risk factor in the abuse of older people. And two clear reasons for this. When older people are devalued, others can feel justified in that abusive treatment. So it means older people are more at risk of abuse. And ageism can also lead to a higher tolerance of abuse towards older people, with some actions against older people not being regarded as abuse, for example. So if we are to make a major shift in reducing the risk of older people experiencing abuse and improving the support for people if they do, we must tackle the root cause of ageism. Next slide, please. So ageism also affects the way in which professionals, health professionals, care professionals, and others respond to abuse. Ageism can mean that professionals fail to identify the abuse of older people. So symptoms like physical injury might be seen as typical to older age, put down to things like falling, for example, when actually it might be mistreatment. It can mean welfare-based responses, where abuse is typically addressed through safeguarding responses, rather than recognising, for example, that a crime has been committed and needs that response. It can also mean, and often does, that older people are not given access to specialist domestic abuse services. And it also results in access to civil and criminal justice being very low. Next slide, please. So I'm going to touch now on some action we're undertaking in Wales, which I hope is of interest and provides a basis for international collaboration. So the Welsh Government, in its strategy for an ageing society, sets out clearly its intent for a Wales where ageism does not limit potential or affect the quality of services older people receive. So it provides a strategy framework for action on ageism. And then more recently, at the end of February this year, the Welsh Government published its first ever national action plan to prevent the abuse of older people. It highlights in that plan the impacts of ageism and the devastating physical, emotional, and social consequences for older people. Next slide, please. So here's the action we're taking now in Wales. I've been bringing together meetings of experts and older people to develop understanding and plans for action on ageism and abuse, bringing together people with lived experience of both of those things and experts both on ageism and on how to provide and good services for people who are victims of abuse and how to prevent that abuse. We are now starting the development of briefings on ageism for use by professionals and practitioners, and we see this as a first step towards the development of training on ageism and abuse. Within the work of Welsh Government now, there is consideration of links between ageism and abuse. For example, in its violence against women, domestic abuse and sexual violence strategy and implementation. And finally, we have, I believe, an important opportunity now for international learning and collaboration. The work we are doing in Wales seeks to improve understanding of ageism and abuse, increase awareness and develop training, make sure that policy and strategy considers ageism and abuse and the ways in which to tackle these things together, and that all of that leads to action. Next slide, please. So here are the contacts for myself and my colleague, Andrea Cooper, who is the safeguarding lead. And we invite you to get in touch with us to share what you are doing on ageism and abuse and what we can do together in the decade of healthy aging to understand the links between ageism and abuse, to develop that awareness and learning and take action to change it so that more older people can feel safe and enjoy their later life. Thank you very much.
Thank you, Helena.
Thank you very much for this presentation. And I'd just like to emphasize just how important this work is. When we published the global report on ageism in 2021, if I remember correctly, we found that there was almost no work going on this link between ageism and the abuse of older people. So it's really good to see some work, and a lot more work around the world needs to be done on this link. Thank you. So now we turn to the next priority and our next speaker. The next priority is generating more and better data on prevalence and risk and protective factors. And our speaker is Fazila Mohamedin from the University of Malaya. Over to you, Fazila. Thanks.
Good day, everyone, and Chris. I'm Fazila. Thank you for joining me today as we address the abuse of older people prevalence measurement. Can I have the slides? Next slide. Obtaining more data on the prevalence is ranked as the second highest priority. However, one critical issue is the reliability and validity of the instrument used to assess the prevalence. Many instruments currently in use were not designed for diverse cultural contexts, leading to potential inaccuracy in the data collected. I'm pleased to present the outcome of collaborative research efforts between University Malaya, WHO, and our esteemed co-researchers on a review of abuse of older people measurement instrument psychometric properties. Next slide, please. Okay, we can move on to the next slide. Our approach was guided by the COSMIN guideline. We identified 68 unique instruments used for measuring the prevalence. These include original and modified versions. The majority of the study were conducted in the high and upper middle income countries. The instrument ranged from assessing multiple forms of abuse to targeting specific types or overall abuse and neglect. 7 critical findings emerged from the review, providing valuable insight into the current landscape of measuring the prevalence. Next slide, please. The main critical finding, we found that there is a lack of methodological quality in the development and content validity of this instrument. Many studies overlook essential qualitative design principles such as concept elicitation, cognitive testing, and pilot studies. Content validity assessments are often not rigorous enough. These factors collectively contribute to the gaps in the current literature on measurement instrument, underscoring the need for more robust development and validation process. Next slide, please. The second important finding on the evaluation of the other psychometric properties revealed that the methodological quality of studies examining these properties varied significantly from very good to doubtful and inadequate. Researchers predominantly focused on evaluating internal consistency and structural validity. Less commonly assessed properties include cross-cultural validity, measurement invariance, and criterion validity. The variability in the data makes it difficult to rely on and compare the prevalence data. Next slide, please. The third important finding was the majority of the study rely on the definition established by the Toronto Declaration, which has been endorsed by the WHO. This framework forms the basis for evaluating instruments that measure at least one of the 5 abuse subscales outlined by WHO, with many instruments covering all 5 subscales comprehensively. There are also instruments measuring subscale or domain which are not included in the widely accepted definition. It is important to note that the future instrument may need to include other emerging types of abuse in the instrument to evaluate the prevalence. Variation in definition and measurement framework may impact the identification of abuse in different contexts and population. Next slide, please. The fourth key point from our review is how the researcher defined the threshold or score that identify abuse. These criteria include the subscale, specific items, response option, recall period, severity, and frequency of abuse. While some instruments incorporated question of the frequency and severity of abuse to derive final score, others did not follow this approach. Response option across this instrument varied significantly. This disparity observed across the range of instruments may contribute to inconsistency in prevalence measurement. Next slide, please. The fifth key finding was that most of the instruments reviewed in this study aimed to measure the 5 subscales outlined by the WHO. However, some instruments were specifically designed to assess only one type of abuse. This is a critical consideration because relying solely on an instrument that assesses one dimension of abuse may not offer a comprehensive understanding of the abuse among older people. Current evidence indicates that many victims experience multiple forms of mistreatment simultaneously. Next slide, please. 6. The review also revealed that many instruments developed for screening purposes, for abuse of older people or assessing other forms of interpersonal violence were used to measure the prevalence of abuse of older people. While risk indicators provide a valuable estimate of prevalence, it is important to note that direct questioning of abusive behavior remains the gold standard in measuring the prevalence.
It's a
Next
lot. I
slide,
wanted to
please.
say there are 2 minutes left.
Yeah, next slide, please. Finally, we found that the instrument translation was insufficiently documented in research studies, which can profoundly impact the transparency and replicability of the findings. This may impede cross-cultural comparison and limit the generalizability and applicability of the study findings. Next slide, please. In conclusion, our review has identified a significant gap in the methodological rigor and empirical support for endorsing specific measurement instruments in this critical area. Despite researchers' widespread use of various instruments, there remains limited systematic evidence regarding their validity and reliability. Next slide, please. Based on the review, a few recommendations are made. Despite the challenges and gaps identified in the current literature, previous research has laid a solid foundation for advancing abuse of older people measurement instrument towards achieving global validity and reliability. To enhance the accuracy and utility of this instrument, we recommend systematically integrating methodological and procedural adjustment tailored to diverse research context and setting. Researchers are recommended to adhere to established guidelines such as COSMIC. Active engagement with stakeholders, including older adult, caregiver, healthcare professional, and policymaker is essential. Continuous evaluation and refinement efforts are imperative to uphold the effectiveness and relevance of measurement instruments. Moving forward, our research team is currently conducting a content analysis of the item used by the previous researcher to measure prevalence. This qualitative analysis will allow us to have a better understanding of the question used in the measurement instrument in measuring the prevalence of abuse of older people. We aim to enhance the reliability and validity of the measurement instrument for measuring the prevalence globally. With that, I thank you for your attention, and I look forward to hearing any question or recommendation from the audience regarding the findings of this review.
Thank you. Thank you very, very much, Fazila. I just wanted to add one thing. This work is part of a broader project where we're trying to generate better data on prevalence, and this is kind of the first stage of this project. The second stage will be developing a new instrument, drawing on the best of what's been identified, and you saw that there's not that much that's really reliable and valid. And then using this, developing, testing this instrument, and then using it in national surveys to try to get a more accurate picture of the abuse of older people. Thank you, Fazila. Now we turn to our second speaker on the priority 2 on prevalence, and that's Lynn Marie Sardina from WHO. Over to you, Lynn Marie. Thanks.
Thank you, Chris. And good morning, good afternoon, good evening to everyone participating in this webinar. Can we have the next slide, please? Thanks, Kazuki. So overall, there has been a significant and reassuring progress in the availability and quality of data on violence against women. However, unfortunately, older women and their experiences of violence and abuse continue to be significantly underrepresented in these surveys. And this is, fellow panelists have said, really impacts and limits our understanding of their experiences of violence, the nature, the extent, and magnitude of this violence. Next slide, please. SDG indicator 5.2 that focuses on eliminating all forms of violence against women actually focuses on women aged 15 years and older. And yet, when we as WHO were generating the 2018 global prevalence estimates of intimate partner violence, we found that less than 10% of all studies and surveys actually included women aged 60 years and older. And this is because most of the survey data comes from surveys that focus on women of reproductive age, 15 to 49, for example, the demographic and health surveys. A review of all survey instruments, and this we did with our colleagues, Chris Micton, Laura, who are on this panel, but also other colleagues like Dr. Claudia Garcia Moreno, showed us that there are various limitations, which Fazila has covered in terms of measurement and psychometric properties, but they also showed that there are significant geographical and income classification gaps in where this data is being generated and published. And so as we can see from these two pie charts, the largest proportion of data, both on surveys on abuse of older people, that is 67% there, comes from high-income countries and to some extent upper middle-income countries. And similar with the violence against women surveys, 54% almost comes from high-income countries and upper middle-income countries, about 15%. But what is stark here is the dearth of data and the very little data that is coming from low-income countries. And next slide, please. Great. So based on that quantitative, really rigorous review of instruments, a qualitative scoping review, and expert group meetings, we together developed some recommendations on how we could strengthen the survey measurement of violence against older women, so we are adequately capturing their experiences and not underestimating the prevalence and their experiences. And how do we inform evidence-based policy and programming? So the first important thing, and I just picked out a few, is the production of sex and age disaggregated data is very important. The sex disaggregated data, particularly so for surveys on violence against older people. The inclusion of types of abuse that are more specific to women 60 years and older. So this includes including newer types of abuse that are not currently included in surveys, like financial abuse, abandonment, etc., which are not common in violence against women surveys, at least. And at the same time, including more relevant forms of abuse within existing measures. So, for example, when measuring physical abuse, in addition to hitting or slapping, kicking, etc., the conflict tactic scale, we should be including things like physical or chemical constraint, with psychological abuse, talking about threats of being sent to a long-term institution. And the perpetrators is another very important point of measurement in surveys that is currently lacking. Most surveys look at intimate partners, etc., but it's really important to include a wider range of perpetrators when we are looking at older women, especially those where there is an expectation of trust, like informal caregivers around children, grandchildren. And next slide. Yes, that's it. And next slide, please, Kazuki. And all of that work that we've done on strengthening measurement of violence against women and on violence against older women has gone into developing this briefing note. There's a QR code there. I don't know if you can scan it, but this brings together, the issues around data availability, methodological issues, but also recommendations for good practice. And we are hoping that this would be able to help researchers, other, those who are interested in conducting surveys on violence against women, but including older women in their surveys, which is highly, highly recommended. And that is also fed into a survey module that we've developed on violence against women 60 years and older. This builds on the WHO multi-country study. And this module is to be used in conjunction with violence against women prevalence surveys and tries to plug all the gaps and weaknesses I pointed out earlier. It has been piloted and cognitively tested in a couple of settings. And I would invite any researchers on here, those wanting to conduct a survey on violence against women or use this module, to please reach out because we want to continue testing this in diverse settings. Thank you.
Thank you. Thank you very much, Lynn Marie. That's important work. Sorry, there we are. Something wasn't working, still not working. I don't know what's happening. Yeah, important work addressing what's really a huge gap on violence against women 49 and older. Till now, really only had data up to 49. We move to the third priority, which is to develop and scale up solutions. And I turn to our first speaker, Dr. Laura Campo-Tena from the University of Cambridge, who's also working as a consultant for us. Over to you, Laura. Thank you.
Thank you, Chris. Hello, everyone participating in this webinar. My name is Laura Campo, and I'll be introducing you on behalf of my team to an intervention accelerator to prevent and respond to abuse of older people that we have been working on for a bit over a year now. Next slide, please. So this is a project led by WHO within the decade of healthy aging. And the project was launched as a response to one of the top priorities, that is to develop and scale up cost-effective solutions to stop abuse of older people. Based on the findings of several systematic reviews, till a few years ago, there was a consensus in the field that no interventions to address abuse of older people had been shown to work based on high-quality evaluations. But this seems to have now changed. We found a total of 89 promising interventions, about a third of which have shown to work in randomized controlled trials. Next slide, please. This is the international network of experts specializing in efforts to counter the abuse of older people that is contributing to the project. And I think with this code, you can access their profiles on the platform's webpage. Next slide, please. Okay, so the intervention accelerator aims to speed up the development of effective interventions for abuse of older people in community and in institutional settings within low, middle, and high income countries. And it has 4 main steps. We have been focusing this first year on the first 2, that is to identify, screen, and create a database of candidate interventions, and I will address that in a moment, and to create an international network of developers, implementers, and evaluators. And in the next stages of the project, we aim to refine and test those candidate interventions selected from step 1, and to develop an online living portfolio of intervention approaches. If we move on to the next slide, you'll see the diagram that summarizes our screening process to identify these interventions. We screened close to 14,000 records. And the interventions screen came from 3 main sources. First, a mega map of systematic reviews on prevalence, consequences, risk, and protective factors, and interventions that was previously conducted by part of the team. I believe you might be getting the link to the protocol somewhere. And then second, our team in Hong Kong updated these searches because the initial searches only went up to June 2021. And then we also issued an international call that was circulated to specialists in the field. And from this process, we identified the 89 unique interventions that were published across 101 papers. If we move on to the next slide, please. And this is the database we have created. It is publicly available now in the platform's webpage. And I believe you're getting the link somewhere as well. So the information in this database comes from these selected publications on the 89 interventions. We extracted data on a series of variables, including aim of the intervention, types of abuse address, who delivered the intervention, outcome evaluation. And when you explore this database, you will see that on the left side of the screen, you will be able to filter the results by selecting from the available boxes. We wanted to thank the Intervention Accelerator team, the group of research assistants that have been collaborating, and also to Kazuki Yamada, thank you very much for making this database possible. And just to say that based on the analysis of this data, we have also prepared a manuscript that is in the process of being published. In the next slide, for example, you will see a map that shows where the interventions were implemented. And so while our aim was to include research from diverse regions, you'll see that the majority of them came from the region of the Americas, mainly the US. We couldn't identify any promising interventions in some regions. One of them was the Sub-Saharan Africa. So our team in Burkina Faso has conducted a more in-depth review that our colleague George Ruamba will tell us more about in a minute. And then next and final slide. Thank you. So this is the stage of the project in which we are at the moment. We're currently evaluating these 89 promising interventions, and the aim is to narrow them down to 10, 15 interventions, so that in the next stages of the project, we can test these selected interventions. And the final slide for real. Thank you, everyone. And we also wanted to thank the Employment and Social Development Canada for funding this important project in its initial stages. Thank you very much.
Thank you, Laura. Thanks for presenting that. Now we turn to George Ruamba from University Joseph Kizerbo in Burkina Faso, and Laura already gave you a sense of what he's going to talk about. Over to you, George. Thank you. Georges, à vous. Excusez-moi, j'ai oublié, on parle français.
Bonjour à tout le monde. Je suis Georges Ruamba de l'Université Joseph Kizerbo, Burkina Faso. L'intitulé de ma communication, qui ressemble plus à un plaidoyer, intitulé Les maltraitances des aînés ignorés et négligés de l'action publique en Afrique. Next slide. Next slide. Next slide. OK. Alors, next also. Alors, pour dire que je prends la parole au nom de près de 63,8 millions de personnes âgées en 2015 et dont le nombre va atteindre plus de 215 millions en 2050. Et la plupart du temps, c'est des gens qui vivent dans des contextes, next slide please, qui vivent dans des contextes assez difficiles. Next slide please. Next, also next. Alors, qui vivent dans des conditions assez difficiles, mais la maltraitance est invisible, ignorée et négligée de l'action publique. Très peu d'interventions dans l'action publique, aussi bien de la part des États que des acteurs de la société civile. Et les quelques interventions que nous avons retrouvées dans la revue de la littérature, c'est des interventions globales, non ciblées à la maltraitance, qui est liée à plusieurs prestations aux personnes âgées, aussi bien en Éthiopie et au Burkina Faso spécifiquement pour la lutte contre les violences liées aux accusations de sorcellerie. Next slide. Alors, au Burkina, nous avons trouvé des missionnaires qui interviennent dans la prise en charge sanitaire, psychologique, psychiatrique vis-à-vis des femmes accusées de sorcellerie. En Éthiopie, il y a INPEA qui intervient dans la fourniture de nutrition ou assainissement. En RDC, à l'association médicale qui intervient aussi dans l'amélioration des rapports intergénérationnels et des plaidoyers pour les droits des personnes âgées. Il faut dire que ces interventions ont pour but non seulement d'agir sur les facteurs de protection, mais également agir sur réduire les facteurs de risque qui agissent, et même pas des interventions ciblées directement sur la question de la maltraitance. Next slide. Next slide. Alors, pour conclure rapidement, je dirais que il est important pour l'Afrique qu'on sache afin de pouvoir agir. Donc, on a besoin de construire des interventions fondées sur des données solides, des données de prévalence, de facteurs de risque et sociologique, et d'avoir une approche systémique des problèmes liés au vieillissement de la population, d'évaluer de façon rigoureuse des interventions existantes en s'appuyant sur les expériences déjà menées. Mais il est important surtout d'appliquer des principes de leadership dans la lutte contre la maltraitance en ayant une vision stratégique qui mobilise les parties prenantes au sein des partenariats inclusifs, une communication convaincante auprès des décideurs publics, des médias et du grand public, et un engagement fort pour créer des environnements favorables au bien-être des personnes âgées. Je vous remercie. Next slide. Thank you.
Thank you, George. Thank you very much. Merci, George. And I just wanted to say that this review that George and his team have done, they just finished it very recently. We will be making it available in the coming weeks on our platform. So now we skip over priority 4, as I explained, and we move on to priority 5, which is raising funds. And we have Dr. Terry Fulmer here from the John A. Hartford Foundation to speak to this priority. Thank you, Terry.
Thank you so much. And a sound check, is that okay?
Yeah, it's fine.
Wonderful. Thank you. And I'm so grateful to not only Dr. Christopher Mickton, but also for Alana officers, just incredible passion for this work. Work that I've been participating in since 1978. And when we have these sessions, I feel optimistic. Today, I'm going to talk about raising funds. Next slide, please. So when you are raising funds, I'm going to state some basics and also say to you that I look forward to any personal contact from any of you after this presentation. So when you are raising funds for elder abuse and neglect, abuse of older people, we know we are underfunded, but what you have to do when you're raising funds is set your fundraising goal. You have to have your purpose and your amount very clear. We will raise $1 million by 2025 in order to address ageism that is so essential to combating elder abuse and neglect. You have to develop a short document, your case to your donors, whether your donor is a government or a foundation like ours, or whether it's a philanthropic person. So you have to have a short, audience relevant document to make it very important to the donor. Know your donor, read about them, find out what they care about. Develop your online living document with your goals. Have a way for people to see what your progress is towards your goals. Sometimes people use graphics to do that, which I think is good. Scan your donor landscape and create a database. So if you're focused on older women, your database should be focused on older women. I'm going to again say that I'm really driving into very specifics, because this is a mistake that people make when they call our foundation. They'll start talking about younger people. Our foundation is dedicated to older adults, period. So we love families, we love all people, but if you call us and you're talking about children and people under 65, you're not calling the right place. So scan your donor landscape, develop a strategy for a coordinated approach. The other mistake people make is they'll have 2 or 3 people call the same place. So be coordinated. Next slide. Sources then. I'm going to repeat the sources I just mentioned. Private philanthropic donors. Sometimes there is that person out there who had a family member, for example, who was abused or neglected, and they want to make a difference. And so know your philanthropic donors in your region or internationally. Again, know your foundations that are dedicated to making a difference, and also be very familiar with your government resources. In our country, we work with the National Institute on Aging. Sometimes we work with the National Institute of Mental Health, and it just depends on how we're moving the needle. But this is really important, because if you don't ask your government all the time, they are going to think that there is no demand. It is up to all of us on this screen to create demand so they begin moving dollars to our area. Fundraisers, galas, events are all important when they're done appropriately and when it's clear that the event is going for the right purpose. And then local efforts. Sometimes you'll see something, for example, like a GoFundMe effort when there's a person or a region that really needs work. Next slide. So a philanthropic example, we have funded, and I'll talk about our foundation, we funded the National Collaboratory to Address Elder Mistreatment in 2016. We made that, these are in dollars, American dollars, so about $770,000. 2018, 1.5 million, and then 1.6 million. This National Collaboratory is meant to bring together everyone in our country, and we welcome people from all countries to join us as we think about the collaboratory to address all forms of elder mistreatment. Next slide. So this collaboratory is now in its 3rd phase. There's a prevention and reduce elder mistreatment by the Elder Mistreatment Emergency Department Toolkit, which is, forgive me when these are very US-centric, but this is a US grant right now. So we work in emergency rooms because that's where you're most likely to see people in critical need of intervention for elder abuse. We have a toolkit, we have partnerships, we do policy-focused convening so that our government listens to us, and we work really hard to develop future leaders. And this is so important because as all of us who have worked in the field for a long time leave our respective positions, we have to make sure that we have a number of people to fill those important roles and keep working hard to eradicate elder mistreatment. Next slide. So our outcomes for this work, and I'll wrap up in just a minute, we've screened 15,000 older people during the feasibility trial. This toolkit is available through the Geriatric Emergency Department Collaborative here. And for all of you to critique, respond, tell us why it will or will not work where you are. We have 6 major health systems who are early adopters working on implementation. And now in this next phase, we really want to ramp up our cohorts of new interns and residents working on this work and thinking about how to take this to scale nationally and internationally. Next slide. So the power of philanthropy and catalyzing partnerships, please keep in mind that the usual view is that foundations can be only give you money, but they also can be conveners. You can say, well, we need funds to create a meeting, or we need to connect with your government. So what you can do is get creative with your funding, look to local funders for convening, tell stories and communicate your successes, find the roadblocks so that we can all help you get to the next stage, so that you have the money you need to do your critical work. Next slide. So for questions, you'll have this slide to be in touch with me and with others in this work. We're grateful to have the opportunity. Next slide. There's so many people on this call today who have just done unbelievable work, and I'm grateful to be among you today. Thank you, and I'll close.
Thank you very much, Dr. Fulmer, and thank you for your foundation and the important work it's doing, and also for this precious advice on to how to go about raising funds, which I think we better start putting into practice. So thank you, and now we turn to our two discussants. And the first of the two is Dr. Claudia Mahler, the UN independent expert on the enjoyment of all human rights by older people. Thank you, Claudia. Over to you.
Thank you so much, Chris, and also to the organizers. I don't know if you hear me. I hope so too.
Yes, we hear you well.
Thank you so much. So thanks to WHO, DESA, OHCHR, and also INPEA. I think it's, as we heard, it's still time to raise awareness to the topic. We are not there yet, but we already heard some promises, practices already today. As Chris showed us, there are 5 priorities which the UN Decade also tackles to raise awareness to abuse, neglect, and violence against older persons. But I also think that we quite clearly see that person matters. I think Helena also showed us that if there is a dedicated person in a country which takes up the topic, this has an impact already. There is then a strategy, there is an ongoing measure, there are other people which are joining. So I think one thing we also learn is that people matter. And in regard of ageism, I also strongly agree that it would be good to have an international dedicated human rights framework, which gives also guidance to member states. Because as you might know, I'm dedicated to do 2 country missions per year. And regularly when I go into a country and have exchanges, it's from governmental side, it's not clear what ageism really is. So I always come across that they are not sure what ageism is. And this is why the measures are also not dedicated to really tackle the issue. This is also true for age discrimination, which is an additional root cause why abuse and all the other issues are not really seen and not combated strategically. So we see a lot of structural issues in most of the countries because, as I said before, ageism is not a concept which they are working with. And age discrimination is very often seen as a minor part of discrimination. So I'm very happy that we once again have the overall report, which was a cooperation from the UN. And I think this was the first step to raise awareness what ageism is. The second issue which was tackled today is data. And I think it's quite crucial because we very often see that there is no data available, especially on the intersectional approach. Older women were mentioned today, but it's also quite true for other intersectional approaches when we see older people in rural areas, older people in poverty, older people living with dementia, for example, but also older indigenous or people from the LGBTI community. We very often don't get exactly the data when abuse, neglect, and violence is hitting them and what we can really do. So I think this is a second quite crucial approach to see that we get better data to improve the measures, which hopefully are useful and will bring release to all the people in this regard. The development and the solution, which we learned today, is that there is not really promising practice till now, but we are really looking forward to learn more about the next steps, how the situation will be improved, and how the interventions are more promising in the next steps. It is also quite interesting to see that we don't have any information how to build an economic case on elder abuse, because what we realize is that there is a lot of abuse, financial abuse, for example, and we also know that there is a huge loss in this kind of settings. So I'm really looking forward to learn more when we are at this stage and have data on this kind of issues, how we can also influence government, that this is a very useful tool to combat violence against older persons, to also better protect the financial cases here. In regard of how to get more funding and finance, I think this was very enlightening, that we really need to know quite clearly what is our goal, how to approach the donors, and how perfectly to address what kind of measures we want to implement, and how we can collaborate with the foundations and with the people who are interested in this kind of issues. I think this also shows that there is a broader network and a broader interest around the world, but we are still not very well connected. And I think this World Elder Abuse Awareness Day is the first step to once again raise awareness and to collaborate quite clearly with all. We are here in the call now, and with all the others who might also spread the word on the issue. I think I stop here, and also there is another one who will speak and facilitate their comments. So thank you so much for having me. Last sentence, I'm the only mandate in the Office of the High Commissioner which has a specific focus on older people. And I think this also shows why it's so critical that we are working together to raise awareness on this issue. I put in the chat my own report on violence against older persons, which also has a couple of recommendations. Thank you so much, Chris, for including me. It was a pleasure to being with you.
Thank you. Thank you very much, Claudia. And thank you for all the important work you do. And I hope we can continue collaborating together and bringing the human rights approach and the public health approach closer together. Thank you. Now we turn to our second discussant, Professor Abla Sebai from the American University of Beirut in Lebanon. Professor Sebai, please.
Yes. Good morning, good afternoon. Can you hear me? Yes. Okay.
Yes.
Yes. Thank you so much. Really, colleagues, it's always a pleasure to participate in events around older adults, and I'm truly grateful for this opportunity to be invited on this occasion of the World Elder Abuse Awareness Day, especially at this juncture, very critical juncture of the UN Decade of Healthy Aging. And just at the time when we are actually celebrating a historic moment at OHCHR, the UN Open-Ended Working Group on Aging. I think I saw one comment in the chats talking about the UN Convention for the Rights of the Older Population. So I'm happy to relay that after 14 years of struggles, we finally were able to move one little step. It's a significant one forward towards a UN resolution that adopted a convention on the rights of older persons. Yet more work on this is to be made for drafting a comprehensive international legally binding issues. And as we have heard from Etienne, I think at the beginning, that it takes a lot of time and a lot of effort to show some kind of progress in this regard. So really very, very enlightening presentations, for me at least. Each of our esteemed speakers addressed one angle or another of this issue at hand, and all underscored that elder abuse remains a significant problem in the community and worldwide. But given its burden, we also agreed that very little progress has been made at the international or local scenes. Can I have the first slide, please? So in spite of struggles, our voice and the voice of older people remain unheard, as we have mentioned. And when it comes to elder abuse, this is more acutely so. So as we have heard, older persons are not a priority, either in policies and interventions, and they are under research and under the issue. The issue is always under research and underfunded. Really, really, as a researcher myself, I struggle when I want to talk to get funding, not only for elder abuse, but for any aging-related issues and issue related to the older population. So this issue is hidden, neglected, and actually sometimes it is invisibilized in both the private and the public spheres, and it demands our attention. As highlighted by our speakers, underreporting is a major concern. It's driven by stigma, by fear, by the dependency of older persons on the abusers on one hand. The challenges, we heard a lot about the challenges with accurate measurements, the absence of standardized tools, lack of harmonized reporting, the data collection system, and many, many other challenges. And when we talk about elder abuse, we talk about the same thing is about all other risk factors for elder abuse. So ageism, for example, have similar challenges. It's a significant risk factor, and we don't have yet harmonized tool. Although I'm sure that you know that WHO is currently working with some researchers in the UK to develop harmonized, culturally sensitive tools for its measurement, and these tools will assess ageism at both the individual and the institutional level, capturing how we think, how we feel, and how we act towards old age. Can I have the next slide, please? So in the next few minutes, I just want to put together a perspective of how I see the mechanisms or the tools, the approaches that we are pertinent to when we want to address a certain specific issue for older population. And here we are talking about elder abuse. And I'm borrowing here from a framework which we have developed for the national strategy of older persons, actually in my home country in Lebanon. In this framework, we address older adults' concerns in different domains. And here we are presenting it in 6 interrelated themes. One theme focusing on health, the other on economic social safety, the third on active participation, engagement in the society, promoting intergenerational solidarity, creating a friendly physical built environment. And one of the major themes which we have included in our framework is preventing elder abuse and supporting victims of violence and those in crisis and conflict situations, which I feel that none of us have highlighted here, because elder abuse in crisis, and you know that wars and political struggles are increasing worldwide. So let me zoom on preventing elder abuse and supporting victims of violence, and see what are the axes which we can use in order to impact in that direction. Next slide, please. So we see over here that maybe we can look at 4 different, I would say, tools, mechanisms, approaches. One of them is looking at the legal and policy frameworks. Strengthening policy frameworks at the national institutional levels with enforced penalties is crucial, particularly when we are talking about elderly abuse. It includes establishing protocols in the community in any setting, whether we are talking about the hospital, care homes, and the like. Also, international declarations like the Toronto Declaration, for example, and which mandates reporting laws for healthcare and social workers could be very relevant when we are talking about policy reforms. The second axis or mechanism is institutional structure. We need to have a kind of a governmental framework for promoting or for taking this theme into and advocating for it. The Madrid International Plan of Action on Aging emphasizes the importance of these structures in guiding governments to develop policies. So policies are important, but we need to have this structure within the government in order to drive forward these policies, such as, for example, national commissions, ministries, units within departments. It could be not only within the government, but also institutional structures in academic spheres, among NGOs and the like. The third mechanism is what we have alluded to, or not what, actually what one of the priority area is capacity building and awareness raising that may include specialized training for health and social workers, for police officers on how to recognize and report and measure elder abuse. And here I would like to stress that also educating the public is about the signs and about elder abuse is important, and the importance of reporting is equally important. Last but not least, and this is one of the main priority areas which we have shared with you in this seminar, is research and data. It's important in enhancing our understanding, including its scope, its burden, the prevalence, the incidence, its types, the risk factors, and data that contribute to raising awareness. And if produced, the data needs to be produced within a research ecosystem which translate the data or the research, the knowledge produced into an action-oriented intervention. So this is what we know about data translation or knowledge translation into policies and programs. We need to have evidence-based interventions, and this is the importance of data, of research and knowledge generation. Over here, our speakers talked a lot about reliability, validity of these measurement tools, and essential to ensure accurate data collection and how to effectively inform policy and intervention strategies. I would like to close by saying that when we talk about before I close, so if I take, for example, one priority, which is ageism, then I can screen, or I can take one of these 4 directions or legal frameworks to impact on ageism. So before I close, I would like to highlight the intersectionality of elder abuse. There's a lot of overlap, of I would say two-way kind of relationship between elder abuse and other constructs such as gender, stability, poverty, you name it, literacy, mental health, cognition, physical health, and the like. So understanding these close intersecting vulnerability is crucial for developing comprehensive prevention and intervention strategies against the older population. Definitely, we need to work together. This is a shared commitment. This is a shared responsibility. And we all look forward to a world where older people are not left behind, are aging with dignity, in peace, and with full enjoyment of their human rights. Thank you so much. Looking forward for more interactions from the floor.
Thank you. Thank you very much, Professor Sibai. And I just want to echo one of the points you made, is the importance of knowledge translation. We can do all this research, it can be the highest quality research, but if it doesn't get out there and it doesn't actually have an impact, raise awareness, have an impact on practice, on policy, it's all in a way a waste of time. So knowledge translation is absolutely key. And we're trying to do what we can through our platform for the Decade of Healthy Aging, where we have a site dedicated to abuse of older people and the various activities we've been pursuing. Now we turn to the questions and answers. And I see that we have more or less the time scheduled, because I'm very grateful to all the speakers for having stuck to their time. So we have a bit of time for questions and answers. And how this will work is that Kazuki has been monitoring the Q&A, and he's identified some questions that come up repeatedly and that are relevant, I think, to maybe more than one speaker, and he'll put them to the speakers, and hopefully we'll get some enlightenment. Thank you, Kazuki.
Thanks so much, Chris. I think we'll have time for about 2 or 3 questions. So if you don't see your question in the Q&A, or if you haven't had the chance to ask your question yet, please do so now. The first question I'm going to pick up is a question from Shmuel Yerushalmi. I'm sorry if I mispronounced that. It's a question about the role of education and the education system in combating ageism, which I think is also a relevant question for combating abuse of older people, as I'm aware that many of the interventions that were listed in the database that we're releasing today is related to educating stakeholders. So any inputs from any of the panelists on the role of education and the education system for ageism, abuse of older people? Claudia.
Thank you for giving me the floor. I'm sure the others have also something to share, but I think it's also a key component to give people in the country an overview what ageism is, and from the beginning to tackle the stereotypes and really bring all the different aspects we have. And also language is one of the key aspects. I would say if somebody is making me a compliment that I look good for my age, I'm now never very pleased anymore, because I see why am I good looking or am I not good looking? So this is just a small endeavor to see that language is something very specific. On the other hand, I think in regard of elder abuse, we very often see that because people are treating older persons with disrespect, this very often leads to violence, abuse, and neglect. And there is a huge connection that we combat ageism through education and also raise awareness what violence, abuse, and neglect really is, that some sorts of violence, abuse, and neglect are seen, because very often it's invisible and people don't know how to deal with it. Thank you so much.
Thank you, Claudia. I'd like to open the floor for any other speakers or panelists who might want to chime in on the role of education and abuse of older people or ageism. If you would like to input, please turn on your camera. If not, perhaps I'll say a few words from the perspective of the WHO. From the Global Campaign to Combat Ageism, the UN Global Report on Ageism was mentioned a few times by many of our speakers. There are 3 categories of interventions that have been shown in the evidence to work to combat ageism. Of those 3, the 3 are policy and law, intergenerational interventions, and the last is educational interventions. So there's clear evidence that education works to combat ageism. And of course, the work is before us to implement that recommendation and to use education to reduce ageism and hopefully also reduce abuse of older people. If there are no other speakers who would like to take the floor for that question, I'm going to take another one, which is, there is a question from Alex Kalache on the role of health professionals and healthcare on the importance of elder abuse. Unless health professionals are made aware of the importance of elder abuse, the issue will continue to be underestimated. Could someone comment? So do any of our speakers have any comments on the role of health professionals, healthcare workers in combating the abuse of older people? Terry, I see you are here, so please.
Thank you. And thank you, Dr. Kalachi, for your incredible leadership. We, in this world, do not have mandatory education regarding geriatrics. And so whether you are in medical school, nursing school, social work, the amount of geriatric content you get is dependent on who feels like doing it. So if you have somebody who's excellent in geriatrics, they might teach it. If they move to another institution, that content may be lost. So we have to normalize, regularize, and require content on older people, ageism, and elder mistreatment. If you ask medical students, they'll tell you maybe they've got 5 minutes, and they certainly didn't get anything on elder mistreatment because they believe it's not their job. Elder mistreatment, abuse of older people is everybody's work. And so it's a mandate that it has to be in all curricula, regardless of whether you're in healthcare or if you are an English major.
Thanks so much, Dr. Fulmer. And then I see Claudia Mahler is also with us. So Claudia, if you'd like to input, please.
I think the question is also key to raise awareness to the issue, because very often I hear from older persons themselves that they are also not taking seriously when they are at the doctors, which is exactly what we just heard. So it's everybody's business to also see that older people are mistreated or are abused. I think from a medical point of view, this should be part of their, learning curve. So how do you see that there is mistreatment and neglect also when in regard of care? This is also a measure of quality of care, and I'm sure the others have more input on these issues. Thank you so much for giving me the word again.
Thank you, Claudia. And now I also see Lynn Marie, who is with us. So please go ahead.
Yeah, just a very quick intervention taking on from what Claudia and Terry mentioned earlier. I think raising awareness and training of healthcare workers is imperative, as much as I think addressing the stigma and the attitudes and norms around violence. This is something we see, violence against women across all age groups. But I think it can be particularly hard and stigmatizing for older women, and sometimes when the carer themselves is the abuser, and they find it hard to disclose the violence. So education, training, and addressing norms is really important among the healthcare workforce, as any professionals.
Thanks so much, Lynn Marie. Unless any other speakers would like to take the floor, I think we have time for one last question. So I'm going to select one that has been voted up. We've heard from a lot of people coming from different stakeholder groups, but this participant Barbara Natukunda, has a question specifically about grassroots organization and perhaps more broadly, civil society organizations and their role in combating elder abuse. So his question, or her question, is how WHO, UNDESA, and our other organizations represented here are working with, collaborating with grassroots organizations in combating elder abuse. But perhaps this question could also be an invitation to reflect more broadly on how we work together with civil society and perhaps other stakeholders to address the abuse of older people. So if anyone would like to say something on this, Claudia, please.
Thank you also for the question. As I said before, it's part of my mandate to have country missions and also ask for input. So from my perspective, it's also key that we get the insights from grassroots because they are very often the voices of older people, and it's also key to get engaged with older persons. And I know that a lot of UN agencies which are working on the ground in the countries do have their exchanges with the people on the ground and bring these insights through their reports to the knowledge and to make it visible also in the headquarters. So having said all that, this is key to speak with grassroots organizations. And I fully understand that it's very often quite hard to attend, for example, the open-ended working group on aging, to bring your perspectives to the audience, but very often it is also possible to just raise awareness on the ground to the office which is working in the country or the regional coordinator. Thank you so much for all civil society organizations who spoke with me during my country missions. This was always fully enlightening and gave a lot of visibility to older persons and the key issues.
Thanks so much, Claudia. And while I wait for another speaker to take the floor, I'd just like to mention that obviously the UN Decade of Healthy Aging is our framework that we're looking at this work on abuse of older people today. The framework explicitly calls for the role of all stakeholders, including civil society organizations. And I posted a few links in the chat about the Decade platform and its dedicated hub on the abuse of older people. We'd like to celebrate and amplify your work on abuse of older people, whether you're doing it at global, regional, national, or even local levels. So if you're doing valuable work on abuse of older people, now's the time to speak with one voice. Please help us amplify your work by submitting your work on the platform and to the Abuse of Older People hub on that site. Chris, I see you're here. So is this an input?
It's both an input and then moving on to the last section. Very brief input. Just want to say, Within the work we're doing for the Intervention Accelerator, in the next phase, when we'll be testing, refining, implementing the interventions, we have every intention of working with civil society organizations, local organizations in the implementation testing, and then hopefully the scaling up of these solutions. But I think now we've kind of come to the end of the time for the questions and answers, and I will hand over to Alana Officer, who is the unit head of the Demographic Change and Healthy Aging Unit, who will give us some closing remarks. Thank you, Alana.
Thank you very much, Chris. I mean, it's such an important topic, and clearly not enough is being done, but I feel kind of excited by listening to this conversation. So much of what's happening is concrete, it's substantive, and I do believe that it's transformative. So a huge thanks to an illustrious panel of speakers and discussants, and thanks to UNDESA, OHCHR, INPEA and colleagues at WHO for this work. Maybe just a couple of reflections, if I may. You know, the success of the decade hinges obviously on our collective efforts, not only to address what we think of as these 4 priority action areas: ageism, age-friendly environments, integrated care, and long-term care, but also critical topics that intersect all of those 4 key action areas. And it does feel that since the decade's been adopted, and particularly in the last couple of years, we are making quite significant strides in tackling a number of these cross-cutting issues, particularly abuse of older people. We heard today, you know, the importance in terms of ageism, of continuing to advocate and raise awareness of the importance of shifting societal attitudes and norms and standards around age and aging, but also around abuse, and making those links more concrete between abuse and ageism. We also heard some concrete examples of what's happening around those intersections, and I think that that's exciting to see it move from advocacy to concrete action. I think it's, you know, it's fantastic to see that there's a new module in terms of extending data on violence against women. And at the same point, we heard that the current 68 instruments to measure prevalence are neither valid nor reliable. So, but, you know, that in the future, we will be able to have an instrument that will have validity and reliability to move this forward. So while today we don't, I think these are exciting opportunities. I mean, you know, I think it's thrilling to know that there are 89 promising interventions that, you know, that we can all now use and work to invest in, but also that through the work that we will be doing, as Chris mentioned, with many of you, you know, we will work to develop and scale up cost-effective solutions, particularly with a focus on low and middle income countries, you know, where George clearly highlighted the gaps. I found it really helpful from Terry also, just the reflections on, you know, concrete steps that we can make to bring more resources into this area. There are pockets of poverty in this work, and it's really, I think, you know, there are a number of sources. So, you know, thanks for the inspiration around how we can move that forward. And so today, you know, our purpose was in part to celebrate progress. I also just want to acknowledge we've got a very long journey ahead to eradicate abuse. But I think some really key sort of thoughts that came out as I was hearing people speak was, you know, the need to, as countries move forward, really to use standardized measures. Because if we're not using uniform tools to measure prevalence, we can't make comparisons across countries. We need to invest in what works. So, you know, rather than trialing different interventions, you know, use the promising interventions that are available in the database, Kazuki pasted, to really, because they show promise, to really test and scale up what we think has most promise now. I think as Masumi also highlighted in her opening remarks, we must strengthen, and Claudia as well, but really building collaboration between governments and civil society and UN agencies, and the fact that if we work together and push in the same direction, we're much more likely to push that flywheel and generate the sort of change we want to see. And I think one of the things that we haven't talked enough about that is the issue also raised by ABLA around building capacity, continuing to increase awareness and support knowledge translation. It's really essential, I think, as we go forward to, and Chris mentioned this, is to pull our strengths, to bring the sort of public health approaches with the human rights approaches together, and bringing the experts from different areas. I think leveraging both those approaches can ensure that both science and evidence supports older people, you know, as rights holders. And I think one of the things that we haven't maybe talked about enough that I really wanted to reflect back on is also that the involvement of older persons in all their diversity, all their representative organisations, but being really central to the sort of policy and decision-making processes. So maybe just a final thanks to all of the co-hosts, the speakers, the discussants that have been involved in this thing. I know we're a very small group, but in the words of Margaret Mead, I think, never doubt that a small group of very thoughtful and committed citizens can change the world. Indeed, it is the only thing that ever has. So on that note, I want to thank you all.
Thank you, everyone.
We'll close the webinar now. Have a good rest of your day. Bye-bye.
Thanks.
Thank you. Bye.
Thank you very much.
Bye-bye.
Bye.
Thanks, everyone.